My name is Tom Lee, and I am one of the co-founders of a company by the name of Simpler. We're a social media analytics company that specializes in the field of healthcare. So I kind of spend all my days wading through the data that makes up the healthcare discussion on Twitter. And we track a lot of things on Twitter, but when it comes to hashtags, probably the biggest subset has to do with healthcare conference hashtags. And just last year alone, we captured the entire tweet streams from 2,282 healthcare conferences from around the globe. About 8 million tweets in total. And we analyze these conferences, and we compare them to one another. It used to be on simple metrics like things like just number of tweets, number of participants. We have since gone on to more qualitative type metrics, looking at things like conversational tweets. This is where people reply back and forth to one another, and they actually carry on a real conversation as opposed to these one-way type of message blasts. And in a recent 12-month period, we studied over 2,000 healthcare conferences and found that Medx has more conversational tweets than any other healthcare conference in the world. And in some cases, it even has more conversational tweets than conferences that have almost 100 times the number of attendees. So, why is that, right? Why is it that Medx excels so far beyond the others? And at Simpler, we believe that a lot of it has to do with the diversity of the stakeholders in the conversations themselves. Let me show you. So what you're looking at here are the top 100 people as measured by the number of times being mentioned on Twitter at a recent Medx event. And what this is telling us is that these are the roles that the participants, both here and online, thought were the most important voices. And these are the median figures from the top 100 healthcare conferences from around the world. Can anybody even see the red patient slice? The yellow caregiver slice? At Medx, individuals rule with 90% of the top voices. And we can take this same notion, and there was a recent article published in the British Medical Journal, co-authored by members of the Medx community, that demonstrated that conferences that partner with patients have better performance metrics than those conferences that do not include patient participation. And these are basic types of metrics, more conversations, greater reach of conversation, and a larger overall audience. And we can take the same notion of inclusiveness and measure it on the social web outside of conferences. And this was demonstrated last year, I should say by last year's winner of the Medx Simpler Signals Everyone Included Research Challenge. It's an annual social media research competition that we co-sponsor. And Dr. Ruth Carlos and her colleagues demonstrated that by reaching out directly to patients on Twitter, they were able to increase patient participation in the Journal of the American College of Radiology's online community. And researchers found that as a direct result of that outreach, that patients had more meaningful conversations with radiologists and other providers about their diagnosis and care. And I just want to leave you with one last thing this morning. This is a network centrality graph that's based on a prior Medx event. And every node that you see up there is an individual that was tweeting, actually right in this room, very room, sitting in the same chair as you're sitting in today. The lines between them are showing how they were connected to one another, sharing thoughts and ideas, points of view about things. But what happens here is bigger than just what's in this room. Because, kind of unlike Las Vegas, what happens here does not, should not, and cannot stay here. And I know there's a live feed right now, so sure, but there's also your voices on the social web. And just like in years past, as the Twitter conversation starts to emanate from Medx these next 2 days, it's going to trigger participation from individuals outside of these walls and from around the globe. So get ready to share, get ready to converse, and get ready to immerse yourself in the diversity that's Medx. Thank you, and enjoy yourselves.